To me, the issue was why would men in Africa be dying of prostate cancer when there is so much history about its management? And the solution is readily available. Virtually every community has dealt with, you find prostate dealt with, and it's written about. It's not that it's not been written about. It's been written about, especially in Kenya. A lot of communities have written or have had written about how they managed prostate in men. So in time like now, I think men suffering from such conditions and doing nothing about it, to me, is really something that is not right. Yeah.
When you say that every community has documented something about prostate cancer, give us examples of how some communities did that, and at the same time, give us a bit of statistics in terms of today how many men might be having or do have issues with prostate.
Prostate, first of all, those prostate conditions, they affect a lot of men. At least at some time in their life. It may be inflammation one time, it may be enlargement, it may never become cancer, because cancer is not that common. So when you talk about people in Kenya, and you're talking about just about 30,000, you see that looks like a very big number. But really, managing 30,000 is not that difficult. If we know where the solution is, and we know where these patients are, they can be treated easily. In the communities, or in the traditional, so-called traditional medicine or alternative medicine, they were easily accessible because the medicine men or medicine women lived in the community. So they would know. They would be easily accessible, and one would simply walk there and they'll get the medications. The traditional medicine, or the herbal medicine, has got so many active ingredients for different conditions, some that we may not even know. So if we take like the one that is taken for prostate, which is the whole range of prostate, whether it's inflammation or it's enlargement or it's cancer, you find the same medication will be very good for even things like stomach upset, like diarrhea. Yeah, sounds unrelated. It's all taken for hypertension. It's all taken for kidney stones. It's taken for arthritis. So even if I have arthritis, but I don't have prostate, even at that very early stage, so I could be taking that solution for the arthritis, but then it deals with the prostate at very early stages. So we find I will not have prostate. I will never be aware that I was almost getting it because of using of these herbal medicine.
I'm just curious. You decided to take the line of herbal medication and not the conventional medicines. What got you interested in herbal medicines? At the same time, tell us about your company. You have health.
I'm not a medical doctor, but I have worked in environments where we have run hospitals for almost my entire life. And I'm very familiar with the economics of sickness and medicine, in terms of what they do to individuals, to families, and even to the economy, because sickness is very expensive. And in my life, I've seen people reduced, from very active people, very active, very resourceful, to incapacitation. Where the people can't do anything for themselves because of sickness. And the question is, could anything have been done? In a lot of cases, the answer is yes. There are those ones that the intervention comes and then has to be taken off because of money. Sickness has become more and more expensive. When I started working, most companies covered employees what we are calling comprehensive. These days you don't hear of comprehensive medical care because it's just become too expensive. People have become very sickly, maybe much more than they used to be because of lifestyle issues. Very little in terms of exercise and really using the body. A lot of times the conveniences of doing everything seated or with minimal movement has been counterproductive in that the energy we save, then we spend it dealing with the sickness. So throughout that, then I was comparing with and asking myself, how come that we didn't have these conditions when we were young? When I was young, personally, I went through a lot of this traditional treatment, both in terms of medicines, and to me, they used to work. Of course, we also used to go to dispensaries. We used to go to health centers, depending on the condition. There was a lot more health education at the primary level. In primary school, we have people coming to give talks about healthcare, what foods to eat, how to prepare the foods, how to prepare ourselves, washing hands and so forth. And therefore, we were more self-aware in terms of what we need to do to prevent sickness, and also self-aware in terms of where to go. So reflecting then back and seeing where we are, where now people are suffering because the organizations now cannot afford, including government, cannot afford to give health care. How about going back to the solution of the past, finding out these people before they completely disappear, and harvesting that knowledge of this tree is good for what and what and what and what, and how is it prepared. If we don't get that information now, we'll probably lose it forever. About 15 years ago, we then started looking at, with friends of mine, we started looking at ways of introducing some of these medicinal plants, actually nutri-medicinal, that they're both nutrition and medicinal plants, identifying them and popularizing them. And so we introduced the aloe vera, and the aloe vera that we introduced is not the one that grows in the wild here. The one that grows in the wild is not good for internal use. It's good for topical use, and it's very efficient. So we introduce the one that you use for mainly internal, but also external. And that is the aloe vera you see around my compound. I've got quite a lot.
Is there a difference? Can you easily spot the difference?
Yes, you can. You can. With this one, it's called aloe vera barbadensis. You find it's very fleshy. It's succulent. You hold it, it's very fleshy inside, and it's clear inside. Looks like a fish fillet, quite clear, translucent. It's not bitter. Once you clean it well, it's not bitter. You can actually eat it as a salad. So we introduced that one. We also then introduced the Prunus Africana, which is now for prostate conditions. Why did we pick on this? First is because there is a lot of knowledge about the two. They have been written about extensively, so we knew we are not taking a risk. There's a lot of literature, scientific literature. A lot of it had been done. The Prunus had been harvested here for decades, from the 1970s. So from the 70s to, it was like 30 years, the tree had been harvested. And people knew that this particular tree is being harvested, it's being exported. What they didn't know is why. Because this was being done during the transition, when we were being transitioned from traditional medicine to modern medicine. And the traditional was seen as kind of primitive. So there was a generation that believed that traditional medicine is primitive. So even when those medicinal trees were being harvested and exported, they didn't think that that is anything important. And the trees were harvested very extensively, from forests like Mount Kenya forest, the Aberdares, Mount Elgon, and they were being exported to Europe. What were they being used for in Europe? For making cancer drugs.
During the harvesting,
yes.
How is it harvested? Secondly, is there at any point where the government or maybe an environmental conservation group raised an issue that the harvesting process caused an environmental degradation?
The way harvesting is done, the correct way of harvesting is to strip the stem, because with the prunus is the bark. So you strip the stem, you cut like say 3 or 4 inches, and you strip all the way down. And then you leave space, and you take another say 4 inches, and you cut another strip all the way down. That ensures that the tree, the branches, the leaves continue getting nutrition from the roots. Unfortunately, the way those ones were being harvested is actually cutting the tree and remove the whole bark and just leave the rest to be used as firewood or charcoal, like that. And because of that harvesting, just cutting like that, many of them, they do not even spoil, they simply die. This is a very hard wood that takes many years to grow. So, because these were not the only trees that were being harvested, the other trees were also being harvested at the same time. So the environmentalists, if there is the issue, it was about the general harvesting or deforestation. There were no, as far as I'm aware, there was no group of people who raised concern about the medicinal plants specifically. Until much later, when, because of the competition was so intense, everybody wanting to have a piece of it, that the government started, not with the pruners really, but with other endangered trees. There were organizations here that were interested, like I believe the ICRAF, or World Agroforestry, was because we were concerned about the particular species, that this species is getting extinct. Some countries, I think like Cameroon, I think it's Cameroon. So the harvesting actually cleared some forests completely. So it's because of that that we looked at the science behind the tree, and we looked at its availability, we looked at the way it grows and so forth, and who it is benefiting, because now it's benefiting people elsewhere, and yet our people here are dying of prostate issues, not necessarily cancer, because really, in my view, cancer is not the big problem, the bigger problem for men. It is the enlargement. The BPH, to me, is a bigger issue because of the number of people involved and also the stage at which they get this condition. Prostate cancer tends to affect people above the age of 60, generally 60, 65, up to maybe about 75. But the enlargement is from about the age of 45 to 65, 70. That's where the population is.
Once you had discovered that the Prunus trick is a solution, you mentioned that you harvested the buds. How do you turn that back into something that is edible?
Instead of just cutting and then having to boil it for the whole day, we realized that in modern times it will be a bit difficult. It's asking for too much. But we know the reason why it was taking that long is because the surface area is very small. If you increase the surface area, then you get the same results faster. So we would crush it into powder, and then that powder, you make it the same way that you make tea. Only that because this is from the bark, while the tea is from the leaf, so the bark is harder. So it needs to take longer than tea. So where tea you could make in 5 minutes, this one would recommend that you take a bit longer, like 30 minutes. And then you can add honey, you can take the same way. You sweeten it to your satisfaction.
Where do you sell it? If a customer wants to buy your product?
We initially we were putting it in the shops, the supermarkets. Will be found in quite a number of supermarkets. But then, as is usual with the supermarkets, if the item is not fast moving, then you find they will not be very keen on stocking it. So we find that the men don't shop. In a lot of cases, actually, the women would pick for their men because they know.
When a woman comes in,
Yes.
someone may be wondering, how can I ascertain that this is the condition that you're talking about and not something else in
Yes.
terms of symptoms? How can you easily identify it?
Some of the very common condition is when it comes to passing urine. One is very frequent visits to the washroom. And that is because what prostate enlargement does is the urethra, which empties the bladder, passes through the prostate gland. So you've got the bladder up here, and then you've got the outlet at the bottom. So the connection is the urethra. Now when it is enlarged, it grows big and outwards and also the inwards, and it squeezes the urethra. So you find you want to pass urine, but you can't because it's been squeezed. Then when you go to the washroom, you find that it doesn't flow. It's a very weak flow because it's constricted. It's a weak flow, and it may or it may not be painful, but it's that constriction, and you definitely know. And then there is also the stopping, that once you have emptied the bladder, then it stops because the bladder is empty. In the case of enlargement, you find that yes, it stops, but the moment you are walking away, you feel the urge again. And in some cases, you find it actually just runs. So it runs, and you find somebody comes with wet pants. Yeah. Now that is a sign of the problem of the prostate, that the urethra has been constricted. There's also, in very extreme conditions now, where you find urine, blood in the urine. That now tells you that the matters are serious, because then it's not only just constricted, it's actually infected. At that point, it's actually very, very, very painful, because now there is no other way of getting the urine. Now, if the intervention does not come, the dangers are that with the urine now getting constricted, it stays in the bladder and can form what we call now the bladder stones. Because of the urea, the bladder stones, which are very painful. If that is also not handled on time, it can get worse and now create problems in the kidneys. Because remember the connection, the kidneys down to the bladder, that now the retention is in the kidneys, and there you can have kidney stones. And in extreme cases, you have kidney failures from the same conditions, simple conditions. In a lot of cases, people respond because there is pain. By the time you have pain, you're actually sick. It's the body saying, you have neglected me for too long. My preference would be, don't wait until the body tells you to take action through pain. So if you take it just as a health product, I think that would be the better lifestyle, I would say. Take these things for prevention. In the case of Prunus, what we have done now, recognizing the challenges that men face, is then to prepare a ready-to-drink product. So you don't have to take it home to be prepared. You can just take in the car, and it's concentrated. And we're very clear about the dosage, so there's no risk of overdosing, although it's very rare, but the dosage is determined, and this is from the science that has been done on this plant, and there's a lot of science, including clinical trials, just like for medicine.
In your research, you said that it causes cancer cells to go through something called
apoptosis, yes.
Can you explain further?
With the cells, all body cells, they come, they live a certain period, and they die. And there is a process of cell regeneration that takes place. And the body has got the mechanism that controls that. That says, you cells, you have lived to your 30 days or 60 days or whatever number of days, it's time to die, okay? That's a natural process. When the cells start misbehaving and they don't respond to that instruction, they don't die when they're supposed to. Others are still dividing. The cells are dividing. So then they increase because the ones that were supposed to go have not gone. That is what then creates the swelling or the tumor. And that is what cancer is. So the science of how Prunus works has been known, has been documented. So there is one of cutting off the blood, the supplies, and they will die. The second one deals with the hormones. What they do is they will close what we call the pathways that the messages go through, is just block those pathways. So the message doesn't get to those cells to divide, to multiply. So that is the process that goes through, and what activates this are now those active ingredients, which is in the plant. Remember, the structure of a tree or a plant is the same structure as in your body, and that active ingredient will go directly where it is needed. And there are the active ingredients actually in prunas are not even 3. There are very many, because you have the active ingredients that will deal with issues like of the kidney, the active ingredients that will deal with the issue of the blood. So although when you take it like that, all those ingredients will go there and they'll find if they are needed. If they are not needed, they'll be flushed out through the normal process of the sweat or the urine or whatever. They'll be flushed out because they're not needed. But the ones that are needed will then be utilized.
And that's what brings about the difference between the conventional medicine.
Absolutely. Absolutely. Because with the conventional, what they do is then they extract the active ingredient for, say, prostate, to do exactly just that, and leave out these ones for dealing with the kidneys and the blood. Those ones are left. They just extract those ones. Yeah. So the shortcoming of that is that sickness, even if I've got a knee pain, the problem is not just the knee. The problem is many, many other things. So if I just come and concentrate on this, because what they're dealing with is the symptoms. They're dealing with the symptoms. So that one, I'll get relief, but it is going to be for a time.
Basically what you're trying to say is prevention is better than cure.
Absolutely, anytime.
You also said that men do not like going for shopping, which is true.
Yes.
So I want you to advise our audience
Yes.
on this, that this product actually works.
One, I want to tell men need to talk. Men need to open up. They need to open up. We say that a problem shared is a problem half solved. Yeah. Even the body, by the way, the moment you talk about it, the body, the hormones in the body start acting on what you have said. On what you have said. This is not a matter of faith. It's not a spiritual matter. It's the science of the body. Whether we like it or not, the utilization of resources in this nation rests first on the men before it goes to anybody else. If you're complaining about healthcare, now we are talking about UHC, and we are saying this is a pipe dream, because it is not going to happen, because there is no money to give universal health coverage unless we do it differently. That differently, to me, is get back to the resources that are there for free, which is these trees and shrubs and plants and so forth. The quacks are there. I think these days not as many as they used to. I remember they used to, go in Jogo Road, every few meters you'd find mganga or whatever, or kienyeji. I think the issue of quacks, in my view, is twofold. There are very few who go there to cheat. The ones in traditional medicine, the quacks in traditional medicine, are just like the quacks in conventional medicine, because they're also there. They're quacks, and I mean we have seen them in the papers. The ones in traditional medicine, they are quacks because they cannot support, they cannot give the evidence that the inquirer is looking for, either in content or in the presentation, the style. Maybe they have the information, but they cannot express themselves the way you, as the inquirer, want them to express. Maybe this is a guy who can only speak Kikamba, and you want him to explain in Kiswahili. He doesn't know what the condition is called in Kiswahili, he doesn't know what the tree is called in Kiswahili. That does not make him a quack. You just need to get somebody knowledgeable, adequately knowledgeable, to translate what he's saying. Looking at it casually, I mean, you see Maasais, with the jerrycans, yeah? And you start asking yourself, I don't see this man carrying many cups. Maybe he's only one, which means he gives you, He is not carrying water. So he gives me that possibility of contamination, but that in itself doesn't make him a quack. What we need to do is to give him facilities, education. Tell him, my friend, things have changed. People, there is, cross-infection, you need to be doing this and this. So they can be helped, because the knowledge they have about that, whatever they are selling, I don't know what it is important. We need to get it first. Then we can multiply it, give it to more people. Of course, the other bit then is the education itself. At what point would the alternative medicine then be included in the curriculum? Whether it is at the point of training medical technicians, whether it's a pharmacist, just at the basic level, because here we are looking at primary health care. So it's not necessarily training doctors. We may not need that now. It's not urgent in my view. It is at the bottom. Those guys we find would be in dispensaries, in the health centers, the healthcare workers. Those are the ones that we need to train on this, because they're the ones who deal with primary health care.